The major developments we are tracking on this Tuesday: confirmed coronavirus cases around the world climbing to more than 18.2 million, with at least 693,000 deaths. Our death toll in this country worse than in any other nation, with more than 155,000 Americans lost. With me starting us off is ABC Chief Medical Correspondent Dr. Jen Ashton. And Dr. Jen, we've been talking about big increases in COVID cases here in the United States. Health officials, some of them saying that we're losing the battle to this virus right now. There are some potential testing solutions that have just been released. What are they?
Well, I want to get to right here. The Rockefeller Foundation put out a 51-page revised and updated report really suggesting solutions. We hear so many people talking about problems. What I liked about this is it took a deep dive into solutions. With respect to testing, we've come pretty far. In April, we were doing about 1 million tests per week. As of mid-July, over 4.5 million tests per week. They're saying it's one thing to reopen, it's quite another thing to remain open. So the solutions they're proposing, we need to get to a point where we're doing about 30 million tests per week. They're suggesting that diagnostic and screening tests be free and readily accessible and available. And they're really calling for ways to develop effective testing protocols. We haven't heard a lot about that yet, and they really propose some interesting solutions in this report.
So obviously we are doing better than we were doing in April, for sure. Obviously, some say that is simply not enough. What are some of the other recommendations that they made in this report?
Well, that's really the key, is that they're seeing where we've come from and where we are right now, but also where we need to go. And they're saying what got us to 3 million tests a week won't get us to 30 million tests a week. So they're suggesting that 90% of current tests, according to their data, are lab-based right now. That's part of the problem because of turnaround time and cost. There are now 4 screening tests that are available in the U.S., and they're distinguishing between using tests to screen a population without symptoms and using tests to diagnose those with symptoms. And the good news, they are pointing to the fact that saliva tests, which were initially kind of unreliable, showing more promise and can get faster results. So their solutions, part of them that they propose, much more on-site point-of-care testing where you can get results in 15 to 25 minutes, and rigorous protocols for screening asymptomatic people in this country. Right now, all of our testing really is focusing on diagnosing those who have been exposed or have symptoms. So a lot of answers in this report, and I'll be bringing them to you throughout.
A lot of work to do, for sure. All right, Jen, thank you so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.